Ever felt a tingling sensation in your hand or wrist? Thought it was just a temporary thing? You might want to think again. Welcome to a journey into the fascinating world of the human body, where we'll explore a condition that's as common as it is misunderstood. Carpal tunnel syndrome, often referred to simply as CTS. CTS is a condition that affects the hand and wrist, causing a range of symptoms that can range from mild discomfort to severe pain. It's named for the carpal tunnel, a narrow passageway in your wrist that houses the median nerve, which controls sensation and movement in your hand. Now, you might be thinking, carpal tunnel syndrome? That sounds pretty rare. But in fact, it's quite the opposite. CTS is incredibly common, affecting millions of people around the world. It's estimated that 1 in every 20 adults will experience symptoms of CTS at some point in their lives. That's a lot of people dealing with a lot of discomfort. So, what does CTS feel like? Well, the symptoms can vary, but they often start with a tingling or numbness in the hand or fingers. This can progress to a feeling of weakness or even pain in the hand and wrist. For some people, these symptoms come and go. For others, they're a constant presence, interfering with daily activities and diminishing their quality of life. But here's the good news. While CTS can be a serious condition, it's also one that's well understood by medical professionals. There are a range of treatments available, from simple lifestyle changes to surgical interventions that can help manage symptoms and improve the quality of life for those affected by CTS. So if you've been experiencing some discomfort in your hand or wrist, stick around. You might just find the answers you've been looking for. To understand carpal tunnel syndrome first, we need to get to know the stars of the show, the carpal tunnel and the median nerve. Imagine the wrist as a bustling city, and the carpal tunnel is like a busy highway running right through it. It's a narrow channel nestled at the base of your palm, bounded by bones on 3 sides and a strong broad ligament on the other. This ligament, known as the transverse carpal ligament, acts like a sturdy roof, protecting the structures within the tunnel. Now picture the median nerve as a vital communication line, like a fiber optic cable, carrying messages back and forth between your hand and your brain. It's one of the main nerves in your hand and runs right through the carpal tunnel, along with 9 tendons that bend your fingers and thumb. The median nerve controls the sensation in your thumb, index, middle, and half of your ring finger. It also governs some of the small muscles at the base of your thumb, so when you're texting a friend, flipping a pancake, or even simply holding a cup of coffee, it's the median nerve that's hard at work, sending signals from your brain to your hand and back. Now let's talk about how these two structures interact. The carpal tunnel, despite its crucial role, isn't very spacious. It's like a narrow alleyway in our wrist city, and the median nerve and tendons have to coexist in this tight space. They do so harmoniously under normal conditions, each performing its function without disturbing the other. But what happens when this harmony is disrupted? Imagine if a construction project suddenly takes up space in our city's alleyway, leaving less room for the traffic to pass. This is essentially what happens in carpal tunnel syndrome. The space within the carpal tunnel becomes constricted, putting pressure on the median nerve. Now that we've got the anatomy down, let's delve into what happens when things go awry. So, what makes this median nerve so important, and what happens when it gets squeezed? The median nerve is like a superhighway of information, relaying messages between your brain and the muscles and skin of your hand. It's sandwiched right in the carpal tunnel, a narrow passageway in your wrist made up of small bones and a tough band of tissue. Now imagine if this tunnel starts to shrink or if something swells within it. Suddenly, the median nerve is under pressure. It's like squeezing a water hose. The water flow gets disrupted. Now let's talk about why this happens. Sometimes it's due to repetitive activities that involve the hand and wrist. Picture a pianist practicing for hours or a data entry specialist typing away the whole day. Over time, these repetitive motions can lead to inflammation and swelling in the tendons that pass through the carpal tunnel. This swelling then puts pressure on the median nerve. In other cases, the structure of your carpal tunnel itself might be the problem. Some people have a naturally narrow tunnel, which leaves less room for the median nerve. Others might have experienced a wrist fracture or arthritis that deforms the small bones in the wrist, again reducing the space for the nerve. Now, what happens when the median nerve gets squeezed? It starts to misfire. This misfiring can cause strange sensations, like tingling or numbness in your hand and fingers, especially the thumb, index, and middle fingers. Over time, this can lead to a decrease in hand function and dexterity,
For example, you might find it hard to grip objects or perform delicate tasks, like buttoning a shirt. If left untreated, the muscles at the base of the thumb may even start to waste away. As you can see, a little pressure can cause a lot of trouble.
Now let's talk about the signs that might indicate you're dealing with carpal tunnel syndrome. The most common symptoms of carpal tunnel syndrome, often referred to as CTS, are pain, numbness, tingling, and weakness in your hand and arm. These symptoms can show up in different ways for different people, but there are some commonalities that most people experience. First off, the pain. This isn't your everyday kind of pain. It's a persistent ache that can range from mild to severe. Often it's centered in the wrist and palm, but it can extend up the arm. It's a pain that can wake you up at night, interrupting your sleep and leaving you feeling exhausted during the day. Numbness is another telltale sign of CTS. It's not just a lack of feeling, it's a sensation that your hand or fingers have fallen asleep. You might find that you're dropping things more often because you can't feel them properly in your hand. Then there's the tingling. It's like a constant pins and needles sensation, usually in your thumb, index, and middle fingers. This can make everyday tasks like typing or even holding a cup of coffee feel uncomfortable or even painful. Lastly, many people with CTS experience weakness in their hand and arm. This weakness can make it hard to grip objects, button shirts, or perform other manual tasks. Over time, without treatment, this weakness can lead to muscle atrophy and loss of function. These symptoms can have a significant impact on your daily life, making simple tasks challenging and reducing your overall quality of life. They can also be quite alarming, as they often start gradually and become worse over time. But here's the good news. Recognizing these symptoms early on can make a world of difference. The sooner you identify what's going on and seek help, the better your chances of managing this condition effectively, minimizing its impact on your life and preventing further damage. Recognizing these symptoms early can make a world of difference in managing this condition. You might be wondering, what causes carpal tunnel syndrome? Well, you're about to find out. Carpal tunnel syndrome, often abbreviated as CTS, can be triggered by a variety of factors. One of the most common causes is repetitive hand movements. This might be something you're familiar with if you're always typing away at a keyboard, playing a musical instrument, or doing anything that requires the same hand and wrist movement over and over again. Over time, these repeated motions can cause inflammation and swelling in the carpal tunnel, leading to the symptoms of CTS. Pregnancy is another risk factor. During pregnancy, hormonal changes can cause fluid retention, which may increase pressure within the carpal tunnel. This pressure can affect the median nerve, leading to CTS. However, it's important to note that symptoms often improve after childbirth. Health conditions can also play a significant role in the development of carpal tunnel syndrome. For example, people with diabetes are at a higher risk. Diabetes can cause nerve damage, which can make the median nerve more susceptible to compression. Rheumatoid arthritis, an autoimmune condition that causes inflammation in the joints, can also lead to CTS. The inflammation can narrow the carpal tunnel, putting pressure on the median nerve. Other risk factors include obesity, wrist injuries, and even your genetic makeup. Some people have a naturally smaller carpal tunnel, which makes them more prone to this condition. Certain lifestyle factors can also increase your risk. For instance, smoking can reduce blood flow to the median nerve, exacerbating CTS symptoms. High salt intake can lead to fluid retention, increasing pressure within the carpal tunnel. It's important to remember that having one or more of these risk factors doesn't guarantee you'll develop carpal tunnel syndrome. They simply increase your chances. But the good news is, by knowing these factors, you can take proactive steps to reduce your risk. Knowing these risk factors can help you take steps to reduce your likelihood of developing CTS. If you think you might have carpal tunnel syndrome, it's essential to get a proper diagnosis. Now, how does one go about getting this diagnosis? Well, your healthcare provider will typically start with a physical examination of your hand, wrist, and arm to check for signs of CTS. This might include looking for any swelling, deformity, or muscle weakness. They may also perform a Tinel's test, where they tap the median nerve at your wrist to see if it causes any tingling or shock-like sensations. If these initial signs point towards carpal tunnel syndrome, more specialized tests might be performed. Nerve conduction studies, for example, measure how fast electrical impulses travel through your median nerve. A slower than normal speed could indicate CTS. Electromyography, on the other hand, measures the electrical activity in your muscles and can help determine if muscle damage has occurred. Once a diagnosis is confirmed, treatment can begin. There are several ways to treat carpal tunnel syndrome, and the approach often depends on the severity of the condition. Mild symptoms might be managed with lifestyle changes like taking frequent breaks from repetitive tasks or using ergonomic devices. Physical therapy exercises can also help strengthen and stretch the wrist and hand muscles. For more persistent or severe symptoms, medication might be recommended. Non-steroidal anti-inflammatory drugs, or NSAIDs for short, can help reduce inflammation and pain. Corticosteroids, either taken orally or injected directly into the wrist, can also provide relief by reducing inflammation. And in cases where non-surgical treatments aren't effective, surgery might be considered. This typically involves cutting the ligament around the carpal tunnel to relieve pressure on the median nerve. It's a relatively straightforward procedure, and most people recover fully with time and rehabilitation. Remember, early detection and treatment are key to managing carpal tunnel syndrome effectively. So if you're experiencing symptoms, don't hesitate to reach out to a health professional. It's your health and you're in control. Prevention is always better than cure, right? So let's talk about how to prevent carpal tunnel syndrome. First, consider your posture. It's not just about your hands and wrists. Your whole body posture can impact the pressure on your carpal tunnel. So sit up straight, keep your shoulders relaxed, and your feet flat on the floor. Make sure your wrists aren't bent while typing or doing other repetitive tasks. Keep them in a neutral, straight position. Next, it's about not overdoing it. Repetitive tasks, especially with a lot of force or in awkward positions, can strain your carpal tunnel. So, break it up. If you're typing, for example, take a break every 15 to 20 minutes. Stretch your hands and fingers, rotate your wrists, give them a little rest. Now, let's talk about exercises. They can help strengthen your hand and wrist muscles and increase flexibility. Here are a couple of examples. First, the spider push-ups. Start by putting your hands together in a prayer position, then spread your fingers apart as far as you can. Now push your palms together and walk your fingers up until they point upwards. Repeat this 5 times. Another exercise is the wrist flex. Extend one arm out in front of you with the palm up. With your other hand, gently press down on the extended hand's fingers so your wrist bends towards the floor. Hold for 15 to 20 seconds, then repeat on the other side. Remember, these are preventive measures. If you're already experiencing symptoms of carpal tunnel syndrome, it's important to see a healthcare professional. They can provide appropriate treatment and further preventive advice. Also, keep in mind that everyone is different. What works for one person may not work for another. It's about finding what works best for you and incorporating it into your routine. Remember, your hands and wrists are vital. They help you interact with the world around you, so take care of them. By taking these preventive measures, you can keep your hands and wrists healthy and happy. We've covered a lot of ground today, so let's quickly recap. We started off with an introduction to carpal tunnel syndrome, a condition that affects the hand and arm, causing pain, numbness, and sometimes muscle damage. We dove into the anatomy, understanding how this tunnel in our wrist houses the median nerve and several tendons. We then explored how the syndrome develops, often due to pressure on the median nerve. We discussed the symptoms, which can range from mild occasional numbness to debilitating pain. We also delved into the causes and risk factors, which can include anything from repetitive hand movements to health conditions like diabetes. We looked at how the syndrome is diagnosed and the various treatments available, from lifestyle changes and wrist splints to surgery. And finally, we shared some prevention tips to help you keep your wrists and hands healthy. Remember, health is wealth, so don't ignore those tingling sensations. You now have the knowledge to take action. Stay healthy, everyone!